To Eli Larsen. Eli is a 2004 graduate of Michigan State University College of Veterinary Medicine and has been practicing small animal clinical medicine since then. He's currently employed at a small animal clinic outside Milwaukee while, while he works on a medical master's in informatics from Northwestern University.
Basically, what I'm going to talk about is the electronic health record that we use at my clinic, Milwaukee Veterinary Service. A little background about the clinic. It's about a $5 million a year clinic. We see about 20,000 patients. We recently added 2 new veterinarians, so we're up to 8 full-time veterinarians with a staff that exceeds 50. We have 8 exam rooms, 2 surgical suites, and we have been using Impromed Infinity since 1984. Starting in 2007, after I'd been here for a year or two, we started exploring Infinity's capabilities for electronic records. And basically in February of 2008, we went live with that, and we've been all electronic ever since. So I'm just going to kind of run through some of the basic modules that I use on a daily basis, and as much time allows, I'll go with how I use Infinity. Not necessarily how everybody else here uses it. So the first module that I use the most is the scheduler. They call it Easy Time. Within that, it's set up for each doctor as to who we're seeing, what we're seeing, and we use different color codes to denote some information. So we have no-shows. I have a different color for my surgeries, not checked in, emergency slots. We have some rounds, things like that. The other thing that we've used Easy Time for is informing doctors of when lab work comes in. So one of my complaints about Infinity is that there's no desktop like what's in the human field to identify when new electronic lab work comes in. So with 8 doctors, we're sending out massive amounts of lab work. All of that lab work is imported electronically, but there's no automated way of informing the doctors that it's there. So what we have is one person who downloads the information into the medical record also creates an appointment slot in a different area for us to look at. So Dr. Randy here has 3 labs that have been received. They're all from Antech. They're color-coded naturally blue by default. And then as we go through our phone calls, make our messages, then I can change the color to lab work finished and keep track of who I have and who I have not talked to. For all client communication, we use the message center. That's for all of our phone notes. And it covers by doctor. So in this particular image, it's just all the notes for myself over a particular time period. And we have different headings. Anytime the front desk takes a message that the client needs a doctor to call them, they're supposed to put a heading, doctor, please call. And when I'm sifting through 20 messages in a day, that jumps out to me and I know I need to call them. After I've called them, I alter the message to say that I've returned the phone call, and then I know that that has been completed. Something else I can click on in there is to look at all the messages for the client. So in this image, we're looking at Tricia Johnson, and it's every message that has occurred for that client. So we have a record of all phone conversations for that client. It's also broken down into by patient, so I can look at all the messages that I've called regarding Daisy Rose if I choose.